So let me go ahead and introduce Bess to you guys. She's the Executive Director of the Justus-Warren Heart Disease and Stroke Prevention Task Force, which promotes policies and activities to prevent heart disease and stroke throughout North Carolina. In her role, she also coordinates the Stroke Advisory Council. She grew up in Ahoskie in northeastern North Carolina and studied English at Meredith College. And she began her career working in women's health, working on issues such as sexual assault and intimate partner violence prevention, HIV prevention, and testing. She got her master's in public health from UNC Chapel Hill and worked in maternal and child health before she joined the task force. And we've had the honor of her presenting for several other groups, and I've listened to her presentation, and it's great. So I think you guys will hear a lot about some great resources throughout North Carolina today. So Bess, I'm going to go ahead and turn it over to you to do your presentation. Thank you.
Thank you so much. Hi, everyone. It's my honor and my privilege to be with you today and to thank you for the work that you're doing. I want to give you a little bit of information about the task force, the Stroke Advisory Council, and also about some resources in our state. And then definitely I want to call upon you guys who are the experts who are doing this work every day. I know that you have a lot of resources and referrals to share with your colleagues, and we definitely want to have time at the end to have you pipe in with any questions or any needs that you're finding, and also with some great resources that you have that you want to share with your colleagues. So again, thank you, and I will start by telling you a little bit about the Justus-Warren Heart Disease and Stroke Prevention Task Force, which is a legislatively appointed task force that began in 1995 when rates of heart disease and stroke were just going through the roof in North Carolina. And some clinicians and stakeholders got together and said, we really need a task force to look into this and make recommendations to our legislature and to our governor to improve heart health, because just way too many people are suffering and dying. And usually task forces, you know, are short-lived. They last a year or two and then they complete their work and they end. But in this case, we have continued because, as you know, heart disease and stroke continue to be problems, and we continue to have huge disparities in heart disease and stroke, in the incidence of heart disease and stroke. So we have 27 appointed members on our task force, and in the big red circle encircling that, we have all our partners like you, folks who are around the state working in this. So we definitely consider you and invite you to be part of the task force. You are a very important part of the task force, and we invite you to come to our meetings, which are open, and also to submit applications to us for any policy ideas that you have. If you see that there is a need in your community and you want to submit to the legislature for some support in terms of a policy change or funding for something, we have a process to get put on our action agenda. So you can find out more about that at our website, startwithyourheart.com. An important part of our task force is the Stroke Advisory Council, which was formed in 2006 to make recommendations to the task force on the stroke system of care, which, as you all know, is always being updated and changed and has is very important. So our next meeting is coming up next week on Tuesday, actually, in Winston-Salem. So if you are near Winston and want to come and join us, we'd love to have you. Our August meeting is on the 10th, and it's back in Raleigh. Usually our meetings are in Raleigh, and we're going to meet at UNC Rex, which has a new heart and vascular center. So we're going to get tours of that, and they also have an area where they can do cooking demonstrations. So we're going to get to experience that and have lunch and get to see their new center on August 10th. And then on November 1st, we'll be back at the Division of Public Health. So if you need more information about these locations, times, and if you'd like to be on our mailing list, I would love to add you to our mailing list. And then if we have meetings in your area and you'd like to come, you are so welcome to come. We also have work groups, which are ways that you can get more involved with us. The work groups meet outside of the Stroke Advisory Council meetings and carry on work. And we have 3 work groups right now: integrating and accessing care, prevention and public awareness, and post-stroke health. So I do invite you to join the mailing list if you'd like to get more information. I promise I won't deluge you with emails. I send out an update once a month at the beginning of the month on the task force listserv, and then the Stroke Advisory Council. I send out information about every meeting, and that's coming up, and we meet quarterly. And then if you join a work group, you'll get emails from that group. So I mentioned our action agenda process, that we have this application process. So currently, what is on our action agenda for the upcoming session? Our legislature comes back to town on May 16th, so very close now. We are endorsing 4 items, including a request for $3 million to expand tobacco cessation services for Quitline. The Quitline, I hope you all know, and I'm sure you do, and I'm sure you're referring to it, is free counseling for people who want to quit using tobacco. Right now, we have coverage, but we don't have enough to pay for evidence-based services, full evidence-based services for everybody who wants to stop smoking in North Carolina. And to us, this is a no-brainer. We need to be doing this for people that want to quit. So definitely encourage your clients, if you're working with some folks who, have been trying to quit and it's been hard, these additional resources that are free may really help them and be a great thing to do in May to quit smoking with the help of the Quitline. Another item on our action agenda is to endorse the request for $7 million in funding for tobacco prevention. You may have seen a lot in the news lately about e-cigarette use among youth. It has risen in North Carolina by 888% among high school students. So we're really, really concerned that students who might not have touched a traditional cigarette are using e-cigarettes and are vaping and juuling. And that leads to use of combustibles. And also, they are addictive. There's this myth that they're harmless water vapor that you're vaping, but in fact, it's not. There are chemicals and nicotine, and people, do get addicted to nicotine smoking e-cigarettes. So we really need to fund tobacco prevention programs. In North Carolina, the funding ended in 2012 for tobacco prevention, and you can see our rates of tobacco use skyrocketing among youth when those prevention programs, when the money for the prevention programs goes away. So we get money from the Tobacco Master Settlement Agreement every year, and we're really working with the legislature to reinstate more of that funding so we can get our tobacco prevention programs back. We're also endorsing a request for $1 million for expanding the Healthy Food Small Retailer Program, and this gives money to healthy corner stores and food deserts to help purchase fresh produce and whole grains and dairy and healthy food for corner stores in areas where people don't have access to healthy food. We're also endorsing Care for Carolina's efforts. Now, if you're not familiar with Care for Carolina, it's a coalition of many, many, many different partners, including folks who work in healthcare, folks who work for insurance companies, Hospital Association, Heart Association, Task Force, of course, and many others, Community Health Center Association, all who are really concerned about the people who make too much to be able to qualify for Medicaid, but not enough to be able to pay for private health insurance. And so there are hundreds of thousands of people in North Carolina in the gap, and we're working to close that gap. So if you're interested in signing the resolution for Care for Carolina or getting more involved in that group, we'd love to have you. Go to Care for Carolina and use the number 4.com and sign their resolution and find out about our meetings. So 2 other items that the task force is working on for the short session will be working with our partners, the American Heart Association, to be sure that Medicaid is covering the U.S. Preventive Services Task Force Preventive Services recommendations for cardiovascular health. Currently, Medicaid in North Carolina covers 9 of the 11 recommended preventive services, but we want to cover all of them. So the 2 that we're not covering are aspirin therapy and nutrition counseling. So we want to cover all these things that we know prevent heart disease. And so lastly on our action agenda is the support of a request for a little bit over $3 million to expand the FNEP program to all counties. FNEP stands for Expanded Food and Nutrition Education Program, which is run out of Cooperative Extension, and it teaches people how to shop and how to prepare food at home and eat healthier and also increase their physical activity. So it is a program designed for low-resourced families, and it is in about 43 counties, and we want to expand it to all the counties so that we can address the obesity problem and lack of physical activity problem in our state. So more information about the task force and the Stroke Advisory Council are on our website, startwithyourheart.com, and also a lot of resources that I'm going to go over today, many of which you will know about. So we are going to look at resources for everything from blood pressure control and management and healthy eating to suicide prevention today. Startwithyourheart.com, I've mentioned, has our meeting proceedings posted, lots of data, and we actually recently at our April 11th meeting did an update on the burden of cardiovascular disease in North Carolina, so there's a lot of new information that you may find interesting under data, and also information on our action agenda, and lots of resources for patients and for providers, including videos. We have a blood pressure refresher video for providers to remind them how to take blood pressure correctly. I always, when I go to the doctor, I'm sitting on the end of the table with my feet dangling, and you're not supposed to do that. You know, you're supposed to sit down and put both feet on the floor and not talk, and, you know, there's so many things, so it's a great refresher. And there's also a video posted on self-monitoring blood pressure to teach people who have been diagnosed with high blood pressure or who are monitoring their blood pressure how to take their blood pressure correctly and accurately. There are resources such as a wallet card where you can write down your blood pressure numbers, all kinds of handouts on, you know, taking your blood pressure accurately. And also information on the Know It, Control It program. Know It, Control It is an 8-session long program that teaches folks how to monitor their blood pressure and also record their blood pressure numbers on the American Heart Association's Check Change Control Tracker. And that is also able to be shared with their providers. So kind of in essence, it tracks blood pressure readings and also teaches healthy lifestyle habits. So we have this program in a lot of areas around the state. So if you have clients that you're working with and you want to refer them to a program, or if you want to start a program, if there's no Know It, Control It program in your area and you're interested, we'd be happy to train you. Aphasia is an issue that a lot of folks who've experienced stroke and their caregivers deal with. And so even though Triangle Aphasia Project is kind of specific to the Triangle area, Raleigh, Durham, Chapel Hill, you can see they have groups in other places and they're growing. So if you're interested in getting information about how they operate, what they offer, how to set up your own program, you could be an affiliate of theirs. They have support groups, they have trainings, and they do just amazing work. I'm actually volunteering with the Triangle Aphasia Project in Raleigh, and just I'm amazed at the people, their resilience, their work, and the facilitators of the program are just so wonderful. There is a national organization too, if you don't have an Aphasia Project group going in your area, called the Association for Frontotemporal Degeneration. This group has support groups that meet by phone and also affiliated ones that meet face-to-face. They have a helpline you can call, and you can refer people and their caregivers to get information. They're very active on social media, as you can see. So in addition to providing support groups and information, they do grants for caregivers, which I thought was really a neat idea, respite grants or grants for them to go and get, you know, to conferences and get training. And they also really encourage research. So they have a registry, AFTDregistry.org, where you can have people register so that they can get better counts and get more research done in the area. I included the Minority Women Health Alliance and Triangle Stroke Support Network because even though they're local to the Triangle area, I put it in as a reminder to say to you, look at different coalitions and support groups in your area. There may be a coalition through the local health department, for example, that is all about health, and you might want to join forces with them to find support and raise awareness around stroke and get support for your clients. If you're in the eastern part of the state, Ashley Elks, who's at Vidant Medical Center, has convened a really large active group in the Eastern Stroke Network, and they're having a neuroscience conference on June 1st, and you can get more information about that conference on the Eastern AHEC website. I think their group meets about twice a year, and they always do like a 3/4 of a day, I think, half a day or 3/4 of a day, and they have educational sessions and a great chance to network with a lot of people who are working on stroke in the eastern part of the state. So I encourage you to get on Ashley's email list if you're not already. Suicide and depression can be results of stroke for many. So definitely always keep your National Suicide Prevention Lifeline number handy. They have ability to chat online for folks that don't want to call and talk on the phone. You can chat, and they have texting also. American Heart Association, as you all know, is a wonderful resource. So I just put a couple of their resources here. Healthy for Good is their initiative to encourage people to eat smart, add color, move more, and be well. Also, they have a high blood pressure health risk calculator. And they have My Life Check, which calculates your heart health score and encourages Life Simple 7, simple seven things you can do to improve your heart health. They also have heart health quizzes to help people understand what things cause risk, like, hypertension and high cholesterol and salt, and tips for eating out and things like that. The CDC I put on here has a heart age calculator where you put in your numbers, and it kind of tells you how old your heart is, what your risk for heart disease is. Medication cost can be a barrier for some, so I wanted to make sure you knew about medassist.org and North Carolina Drug Card, which are prescription drug assistance programs. Faithful Families is a curriculum and a program that is run out of Eat Smart, Move More, North Carolina, which is a movement that encourages people to do just that, eat smart and move more. So it's all about healthy eating and has great tips for healthy eating, everything from how do you have healthy food at meetings to how do you have healthy food at churches to how do I do this individually, how do I plan my meals and shop for food and cook at home and, cut out some of these habits that maybe aren't as healthy. And recently, Faithful Families worked with the Division of Public Health to create a Go Red toolkit for heart health. So all this is posted on Faithful Families, mm.org. So definitely check out Faithful Families, and they're located in churches all over the state. So you may have some in your area, or you may want to start some in some congregations that you know of. That might be interested in getting their congregants healthier. Eat Smart, Move More, I mentioned, is a great movement. If you're not on their listserv, definitely email them and sign up and connect. It's free to become a member, and they have just great resources and information and a wonderful newsletter that gives you tips every month when the newsletter comes out. They do great webinars and have lots and lots of helpful useful resources like walking logs, activity logs, activity planner to help people, choose to and schedule for more physical activity in their days, in their weeks. Here's one for healthy meal planning. And these are just some examples. They have lots and lots and lots of great resources. They also have a listing of health educators that work in all the health departments around the state. So if, for example, you have someone who's moving after a stroke and they're moving to go live with a caregiver or a child or something, and you can look up and try to connect them with resources in that new county in North Carolina. They have information on which farmers markets accept SNAP. So for folks who are trying to eat better, they say, oh, I can't afford, to eat like that, or I want to eat, fresh vegetables from the farmer's market. Well, great. Let's find out where you can use your SNAP benefits. I've heard, too, recently that many older people who qualify for SNAP don't apply for it, don't get it. And so it's very important for folks who are recovering from stroke and for folks as they're aging to eat well. So definitely get them to sign up for benefits that they need. Eat Smart, Move More has an expanded program called Eat Smart, Move More, Weigh Less. It's a online 15-week weight management program that works. And it has, it's online, but it has a real-time, real live instructor, who gives you feedback and messages you online and answers your questions. And it has a great group feel for folks that are trying to lose weight or maintain their weight. Lots of great resources on sodium reduction from Eat Smart, Move More, Weigh Less, and from the American Heart Association, just lots and lots of great things. So if you're working with clients and they talk about how hard some of these things are, you can provide some great information for them from the web. Med Instead of Meds is a website that has a lot of recipes and information about the Mediterranean diet. A lot of people eat this way, and they've found it really promotes heart health and reduces risk of chronic disease. It includes eating more fruits and vegetables, eating less meat but lean meat and fish, lots of whole grains, and there are wonderful recipes that are very simple. A lot of people say, oh, I can't change my whole way of eating. I don't know how to cook like that. I don't know. It's not good. But these recipes are really simple and really delicious. So I encourage you to check out medinsteadofmeds.com or refer folks if they're trying to get some ideas for healthier eating. I mentioned the Quit Line. They've got these. So definitely keep referring folks to the Quit Line and to get some support for quitting smoking. Diabetes management, lots of folks with heart and stroke issues have diabetes, and there are wonderful programs in North Carolina, and you can find out about them on diabetesnc.com. There is diabetes self-management education and support for folks who have diabetes, and they learn about living with diabetes and managing their diabetes. DPP is diabetes prevention, and that is for folks who have pre-diabetes, or maybe they have some risk factors in their history or their family, and it's great to get in there and try to prevent it and establish these healthier habits before they develop diabetes. And Eat Smart, Move More has a Prevent Diabetes program too, esmmpreventdiabetes.com. There's also an online resource for women living with diabetes called Diabetes Sisters Voices. So that may be an appropriate referral for folks that you're working with as well. In North Carolina, we're very fortunate to have ODHDSP regional coordinators, and that stands for Obesity, Diabetes, Heart Disease, and Stroke Prevention regional coordinators. I know that's a mouthful, but you can go to this website and find out who your regional coordinator is in your region, if we have one in your region, and connect with them, and they may have some resources for you, and they can let you know what they're working on in your community to improve the health of the residents in your community. I understand you've had a webinar from the Area Agencies on Aging, so I'll just leave this website here because I think you already have a lot of information about them, but they have some great resources and programs too. Falls prevention is another thing that's really important for folks when they have had a stroke and they are at increased risk for falling. Healthy Aging NC has a lot of great stats on falls in North Carolina, and also information on all these workshops that are available for folks. So I will stop there, and here's my contact information. So if you want to join our listserv for the task force or the Stroke Advisory Council, please just shoot me an email. So thank you.